Radiotherapy has both immune stimulatory and immune suppressive effects, even in the field of radiation. So it also induces some mediators of immune suppression. I'll discuss those in a minute. But of course, if you want to enhance the pro-immunogenic effect of radiotherapy, you can enhance the pro-immunogenic effects, or you can somehow interfere with immune suppressive effects. You have both possibilities. And one very tempting use of radiotherapy is the induction of cell death that comes from radiotherapy, with the hope that that will induce neoantigens, so they will induce neoepitopes, so somehow reshuffle the information that comes with the tumor, so the immune system now would recognize the tumor. Many people have tried to pin down these neoantigens of radiotherapy. Is not easy because once you have a successful immune response, to track down what was the epitope that induced that immune response in reality is not that obvious. And if you introduce like an exogenous antigen like of albumin, is so immunogenic that inevitably the tumor would be rejected. So, the complexity of identifying neoantigens is that for a neoantigen to function, it has to survive immune editing, right? So it has to be somehow capable to not being eliminated. And if once it's persisting, it has to be robust enough to elicit an immune response, so to go through cross-presentation, elicit immune response that is then capable to reject the tumor. So I think radiation may participate in inducing neoantigens. I also think radiation has a much more established mechanism, and I'm going to discuss it tomorrow, which is through the DNA damage response. It converges directly with the immune system, particularly with innate immunity, by stimulating the induction of type 1 interferon. So the double-strength breaks, that DNA breaks that come from radiation, elicit a response through sensors in the cytoplasm of cells called STIGAS and STING pathway that read this in the cytoplasm, the presence of these fragments of DNA, and through that pathway they induce type 1 interferon. Type 1 interferon is key to recruit the correct dendritic cells for cross-presentation and rejection of tumors. So it's a very nice convergence of an effect of DNA damaging agents, whether it's platinums or radiation, and innate immune system. And then the innate immune system somehow jumpstarts the immune response, and then you have these epitopes that are released by dying cells, and if you are lucky, enough T cells in the right place in the right moment, and so the patient cannot be too immune suppressed. So ideally you're treated upfront, not too late in the course of the disease. And if you are lucky, you now build a specific immune response that is capable to reject the tumor. It's capable to reject the tumor at the tumor site, and possibly, if the metastases are similar to the tumor, and metastatic settings as well.